Something else we read in the press today is criticism of the government. Well, there we go. That makes a refreshing change. To criticise the government. Everyone seems to be doing it at the moment, as it has delayed the award of new pay rises to people who work in our NHS, including our nurses and other people in that in support roles, particularly in the NHS, which should have come in April. It has been delayed because the government apparently has been dragging its feet with the independent pay review body and providing information late. This is not unusual. It apparently happens every year, but it is being blamed for people wanting to leave our health service. Joining me now is NHS GP and producer of the documentary, The Greatest NHS Heist, Dr. Bob Gill. Bob, thank you so much for joining us here on talkTV. Explain to us a bit of the workforce pressures that are being brought to bear and are being blamed on this delay on people's pay increases in the NHS.
Thank you. Yes, so, we've had a decade of a relative pay freeze, which has led doctors and nurses to be, in real terms, 20 to 30% worse off than they would have been had pay kept up with inflation. And we've seen the public sector, particularly in the NHS, hasn't kept up with the private sector. So the staff who are working in more and more overstretched conditions are also finding it's a double whammy, that they're earning less for even greater effort. And as a result, we have a big problem in terms of recruitment and retention. 10,000 doctor vacancies, 40,000 nurse vacancies. These are old figures. It's probably worse than that now. And we have this industrial action. So, the government is resisting settling the pay disputes. It wants to continue wage suppression because ultimately what their policy agenda is the privatisation of the NHS and delivering a very cheap, compliant workforce to private operators is their political objective.
OK, well, I mean, that's certainly what you think's happened. It's not something I would accept. This isn't unusual for the pay negotiations to go on beyond April. In fact, I was looking back, I think it's happened for most years in the past sort of decade, actually. And before, there is an independent pay review body that was set up to take decisions about NHS pay out of the hands of politicians and put it in the hands of experts. Is that not something you support?
Well, how independent is this pay review body? They are people selected and nominated by government. So I don't accept they're truly independent. All you have to do is look at the crisis within the NHS. The government is saying it wants to address the waiting list problem. We've had a recent study coming out of the Royal College of Emergency Medicine saying there are 250 preventable deaths every week due to the pressures within A&E. Now, if you do not have the staff to do the work and to look after patients, you're going to have preventable harm and death, as they've pointed out. So the government needs to decide whether it wants a functional health service for which it has to pay reasonable salaries to the staff, or it doesn't. And at the moment, it's clear that this government doesn't want to solve any of the problems that largely it has created through its 10 years of austerity and relative defunding of the NHS.
But there hasn't been any relative defunding of the NHS because NHS spending has gone up in real terms over the period of the last government. And last year, nurses were given a 5.5% pay rise, I believe it was, plus a £2,000 one-off payment. That was the average. I accept that's the average. Not necessarily every single person would have got it. Junior doctors were given an 8.8% pay rise. That would match many of the pay rises that we saw across the private sector. In fact, in many cases, would be a lot more generous.
Yeah, but you're overlooking what I stated earlier, which is the 20 to 30% relative wage loss over the decade. So if you take away 30% and you give back 6%, you're still 24% worse off. So the incomes within the public sector, within the NHS, of doctors and nurses lags behind the private sector if you take into account inflation and the austerity program that was put in from 2010 onwards. So relatively, and compared to health professionals in other countries, the UK is squeezing the NHS staff extremely hard, and they're voting with their feet.
Okay,
Either
well,
they're
Dr.
taking
Gill,
a
you've made that point, you know, and it's a very valid
Yeah,
point for you to make.
and
Can I
your
just
other
ask
point
you this
about the
then? Junior
funding.
doctors are seeking a pay rise in excess of 20%. I can't remember the exact figure. Where should the money come from? What taxes do you think the government should put up, or what services should otherwise be cut to fund these pay increases? Because there's a finite amount of taxpayers' money, and you know, by definition, money you spend on the NHS either has to come from increased taxes or taken from other services. What services should the government cut, or what taxes should rise to give doctors a 20% pay rise?
Okay, so there is a massive problem of tax avoidance, tax evasion, offshore loopholes to avoid paying tax in this country. There are major corporations that pay negligible tax and don't contribute to the functioning of society. You have companies with complex tax arrangements that don't contribute to public services. Yet they're quite happy for their staff to be looked after by public services.
But Dr. Gill, the government would say quite rightly that it's put record amount of money in avoidance and evasion, and the tax take is what it is. And of course, while you can clamp down on many of those loopholes, and we absolutely should, because everyone should pay their fair share of tax, it is messing around one end of the decimal point, isn't it? It won't create enough to give a 20% pay rise for all doctors, I would suggest, although I don't have the figures in front of me. Look, moving away, Dr. Gill, if I may, from staff pay, you will be aware, working on our NHS, that this week is Autism Awareness Week, and as a father of an autistic child, it's something I am more than aware of, not just here on talkTV, but in my home life. There's been an unprecedented increase in the number of ADHD referrals. I can give you the figures from East Lancashire, where I'm Member of Parliament. We've seen a 200-300% increase, particularly in ADHD, but autism referrals to the NHS with no new resources. And I accept the point that there is a challenge around resources, particularly looking to give families support. What do you think that's linked to? Because it's important that we discuss that in Autism Awareness Week.
Yeah, so there's a growing awareness, particularly around ADHD. You've had high-profile celebrities and various TV programs raising awareness. You know, a lot of people may have one or two traits of ADHD and want a diagnosis, and this is driving demand. You know, patients of mine, particularly young children who don't seem to be developing appropriately, they can be languishing on a waiting list for up to 2 years at the moment, waiting for a diagnosis. Now, without the diagnosis, they don't get the appropriate support and funding they need through schooling and social services. So it's having a massive knock-on effect on families. And, you know, you talk about funding. Well, we have an NHS which has now become very management top-heavy.
Yeah.
The bureaucracy of the NHS is leaching out in excess of 10%.
Dr. Gill, do you think we can link this back to, so as I say, in East Lancashire, I just happen to know the figures because I'm a local MP, you know, between 200% and 300% increase in referrals for ADHD. Do you think we can link this back to the COVID pandemic, or is it, as you say quite rightly, in Autism Awareness Week, just parents and carers and people who support families being more aware of it?
There's no doubt that the lockdowns and disruption of schooling has had an effect on children's development, and some of that may raise concerns about other diagnoses. So yeah, there may be a sort of rise due to the precaution of not wanting to miss a diagnosis. Certainly that is contributing, but you know, the money that we have for social care and the health service, we need to look at where it's actually going. How much is going into administration, bureaucracy, management, and servicing private finance initiatives?
Dr. Gill, thank you so much. We're running very short on time. It's a really important point. But of course, if you give money to everyone in pay rises, you can't support other services. And I think our viewers and listeners will understand that. Thank you very much for joining us. Very quickly, because we are looking to go to our break. But Becca, I mean, a really important Autism Awareness Week that we talk about it on shows like here on talkTV.
Yeah, absolutely. And I think, you know, when people are more aware of the symptoms, more aware of how those things present, I think that's only a good thing to ensure that people get the support that they need.
Absolutely. And the link to ADHD is interesting. And there's a whole discussion this week about whether, you know, people can have both at the same time, AUD, you know, so I think it's a conversation we should be having.